Hello, my darlings. I hope you're doing very well. Welcome to the very first episode of Don't Hold Me Back, the first podcast created with and for people with learning disabilities. My name is Jules Debellis. I use they, them pronouns, and I'll be your host. This is a multimedia project created by the Elfrida Society, a charity based in Islington, London, which has been supporting the local learning disability community for almost a century. We'll talk more about its history very soon. Joining me today as co-host is our expert by experience, David House. Hello, David.
Hi.
And our very first special guest is Ollie Galvis, the CEO of the Elfrida Society. Hello, Dolly.
Hi. Hello, Jules. Hello, David. David, how are you doing?
How are you all doing?
Great. Yeah, great to be here.
Thank you for joining me for this very first episode. Before handing over to you both, I'd like to take a moment to explain why this podcast exists. Don't Hold Me Back was born from the Elfrida Society's need to reach a wider audience and to make its voice heard. For decades, we have been fighting and advocating for better living conditions for people with learning disabilities and supporting them in overcoming the structural barriers of a society that is simply not designed for people who are different. This podcast is about exactly that. All those obstacles that risk undermining the well-being of people with learning disabilities and how we can overcome them together. In our monthly episodes, we'll be talking about access to public healthcare, mental health prevention, community safety, relationships, and much more. In every episode, I'll be joined by an expert by experience and a professional specialized in the topic of the day. Today's theme is the historical, social, and cultural context that makes this podcast so urgent. So, David, why do you think this podcast is so important, and how do you think it can make a real difference?
I think this podcast is going to make a massive difference for people with learning difficulties because people with disabilities haven't had a lot of chance to express themselves, and it's kind of as I see it is we've been doing a lot of campaigning and stuff uh, with across London, across the UK, and things have improved, but it's kind of a step forward and then a step backward sometimes, and some things are really still difficult, and we're not in a perfect society where people with disabilities have a chance to say what the issues are sometimes, and it's kind of really difficult, and we want to get the services right for people, and it's really challenging when different governments change, and then some governments will look at people with disabilities very well, but then some don't.
Thank you, David. You're absolutely right, especially in regards of the fact that it's a little bit like unstabling when governments change and you don't know what's going to happen and if all the progress that we've made is going to be kept or everything is going to be erased. So definitely. Thank you very much, David. At this point, Dolly, would you like to tell us about the history of the Elfrida Society and what it does today, so that then later we can talk about a little bit more about the topic of today's episode?
To start by saying thank you to you, Jules, and to you, David. Without you, we wouldn't be here today. So it's very exciting that we are filming today or recording our first ever podcast. And there's so many out there, but this one is a special one. And it is because it's all about listening and all about live experience. So I'm just proud and excited to be here. So thanks for the invitation and for giving me the time to come and introduce our organization. So I'm Dolly Galvez. I'm the CEO of the Elfrida Society. I've been at the Elfrida Society for 6 years, and it has been a roller coaster of amazing fun, but a lot of challenges. And as David already said, um, we deal with lots of changes all the time, and everything changes every day. So, as a charity, we had to adapt. Jules mentioned that we've been around for a long time. This year, we are 106 years old, so we have lots of experience and long existence, a helping, supporting, and working alongside people with learning disabilities. And more recently, we kind of open our doors to people with neurodivergent needs as well. Sometimes people have combined diagnosis. So we are open to anyone that comes under the umbrella. And we are very proud to work with so many people with lived experience who are our experts. Through our long history, I'm sad to say that we haven't really changed much in terms of our aims and objectives. They're still very relevant even today after 100 years. We maybe use different language, but we're a bit more liberal, more open, more uh, kind of trying harder to achieve equality, and that is still very much what we're doing every day. So we are trying very hard to ensure that we are listening, that we're listening to the people that we support. That is at the heart of everything we do. And obviously, we know that, yeah, we can improve, and we can improve every day. But we do a lot of listening. We listen to understand people's experiences, people's feelings, emotions, their strengths, their challenges, the barriers that they face, and their hopes and aspirations for living an independent life. So we try to do that across everything that we do. And I think this podcast is based on the same principles. And we are here to listen and to learn. And I think in terms of what we do now, we provide lots of services that are designed with people with neurodivergent needs, and they are aimed to try and help people to break those barriers that they face when it comes to accessing services. So we have a number of services, including healthcare, advocacy. We've been running workshops for the last 18 months, monthly. Jules has been part of that. We've been working very closely with hospitals, GPs, professionals to kind of raise awareness, to try to listen what is going on, to understand their own challenges because they face many. And I think it's important to say that that no one is to blame for what's happening and for the barriers and the problems that people face. It's the system. It's a system problem. The system, sadly, were set up without thinking about people with learning disabilities and neurodivergent needs. They were left out of those conversations. They didn't think about how the setup and the procedures and the processes impact them, and hence we are trying to change that. So we work with everybody that supports people with learning disabilities, as well as the learning disabilities community, very closely and in partnership and through co-production. So yeah, those are the services that are relevant today, I think. We also like to support people to have fun, engage, make friends, and be happy. So we have amazing sports activities, and we try to run social events as well, because making sure that people are included, happy, have connections, make friends, help us to kind of keep people happy, but also to raise awareness and to share learning and to share experience and to kind of be able to influence and make a difference when we can.
Absolutely, Dolian. Thank you very much. I would now pass it on to David, because David, you're not just our expert by experience today, but you're also an expert by experience at the Elfrida Society. So would you like to share with us what your role is and what does your team do in order to improve the lives of people with learning disabilities in Islington?
Yeah, I've been working for the Elfrida Society from 2006, and we go and have a look at people's houses, ask them some questions, see what the services they are getting from the providers they get, and they are happy with the service they're getting. And we will ask them some little questions, kind of, and we will feed that back to the council, and we will make recommendations to the council of any changes to the managers as well, to let them know where improvements maybe need to be made, really. And it's really, really good, because we recognise certain things that have been wrong in the past, and we've made a change, and made that work with the council, with the managers, to make that system better for the residents of Islington. And it's really, really good, because it's really, hopefully they feel like they're getting their voices listened to through this service, really.
Thank you, David. It's so important. And I think that's something that Elfrida should be proud of, is that I think it's like over 60 or 70% of people working at Elfrida are part of the wider neurodivergent community.
Close to 80%.
Close to 80%. Amazing. So yeah, this is fantastic. And I actually have now a question for you, Dolly. What's the wider context of the barriers that people with learning disabilities face in their everyday lives? I'm thinking especially about well-being, both in terms of health and human connections.
So I think the main barriers are because a lot of the systems are quite complex and overwhelming. If we talk about healthcare, we had amazing healthcare in the UK. It's well known in the world, but it's under pressure, it's under capacity, and even when it's not, it's just, as I said before, it hasn't been set up with people with different needs at the heart of it. They weren't part of their design, especially people with learning disabilities. It's just not well set up, and that results in a number of barriers for the people who are trying to access them when you have those special requirements. And I say special, but they not really special in a sense that require more investment, or they're not complicated ones. And I can elaborate on that. But yeah, people with learning disabilities typically face lots of barriers. That also applies to people with neurodivergent needs. And that could be, for example, very short appointments with GPs, or very short time to actually explore what's going on with your health when you're seeing a clinical professional. It could be the environment, the space, the surroundings are not well equipped to help people who have sensory needs, for instance. Is very fast. It relies on a lot of potentially written information, verbal information, but very difficult medical terminology is used. It's not easy read, it's not accessible in any way. It's very fast moving, and the clinicians don't have time to actually listen and see it, and allow time to actually be curious about the person that they have in front of them, to understand the needs, to make them feel safe, and that they can trust the service, the person, the offer of care. They don't kind of have that capacity to understand that the person in front of them might need very little adjustments to be able to engage with them effectively. And I think those are the main ones. I'm probably missing lots, but that kind of summarizes what we hear from people all the time. I would like to share a little case study. We had a person that we helped that was diagnosed with cancer. and the diagnosis was very overwhelming, very confusing, and very frightening. And the person didn't engage with the clinical staff about a exploring treatment, or even to listen to what needed to be done, not because they didn't want the help or didn't want to get better. It was because it was too frightening, it was too confusing, it was too much, and nobody had taken the time to actually explain in a way that made sense to them. So luckily, the learning disabilities nurse at the hospital made a referral to our healthcare services, and we were able to provide a health advocate to work with them. The advocate was able to accompany them to appointments, to interpret the information, but also to interpret emotions, to take the time to ask questions, to explain the process, what was going on with the diagnosis, but also the treatments, what it involved. And the advocate was able to go with them to appointments and kind of be there, not necessarily to talk for them or take the lead, to be alongside them, to be able to cope and be there to ensure that the process was working for them. And after that, the person was able to engage with care, with the treatment, and that was very positive in a way. Obviously, we couldn't do anything about the cancer and the diagnosis, but facilitating that process and ensuring that they were able to get treatment and to get access to that in the same way that anybody else will have is very important. And that is something that we do for lots and lots of people. So, for instance, in the last 18 months, we deliver about 600 hours of one-to-one advocacy support, on top of obviously all the relationships and all the collaborations and everything that we do. So the reasonable adjustments that are needed are not huge things, are not expensive things, are not complicated things. As I said, it could be just somebody to interpret information, to explain what's going on, to interpret your emotions, because obviously you're reacting to something that is new and is scary, to give you that time to kind of take in what's going on and be able to take control and make informed decisions so you can take care of your health and your well-being and be included. People with learning disabilities, according to the NHS, it's the statistics, die 19 and a half years earlier than anyone from the general population. If you are from an ethnic background, then the outcome is worse. So you die even earlier. So if you are from a Black ethnic background, for instance, and have learning disabilities, you're more likely to live to around 35 years of age. That's young. That is really, really scary and worrying. So that kind of, to me, demonstrates that learning disability is compounded by race and vulnerability when it comes to barriers, and that is concerning. So the statistics is important to kind of understand that they not just numbers and statistics, they represent thousands of people's lives and families that are having to deal with losing a loved one. A lot of those are because they are things that can be avoided if the reasonable adjustments were made, if people were given the opportunity to be seen and heard and understood, and if they were given those small reasonable adjustments so they can actually engage with care. If they engage with care, they will get positive outcomes, and that helps everyone.
I would add also that isolation can be like a big part of the problem, because health is not just physical health, it's also relational health, and people with learning disabilities tend to be more isolated, not just from services but also from human interactions. And that would mean that less people care and less people see and hear and listens to them, and that leads to people just like not noticing if someone is unwell. What do you think, David?
I was going to say, yeah, I agree. I think it's the outcomes for people with disabilities in Islington or across London or anywhere are not great. And I think it's really good that organisations like the Elfrida Society, MainCap, other organisations are around, and it's partially giving people advice as well. And uh, this is where annual health checks help for people with learning difficulties. I've recently come the age that I have annual health checks, and it's really useful because you can, if you are concerned about something and you want to raise it, you raise it, and that's one of the things you've got to raise it. And it sometimes you do need the little bit of help to from people who, either the support workers or individuals working for organisations, um, come with you to help understand the medical information, because it is so complex. And I think Dolly is right. It's really difficult because the Society for the NHS is for people with learning difficulties doesn't fit, and it's all the doctors are being trained in a certain way, and it's good because they've been trained in a medical way, but when explaining it to a person with a disability is no good because they don't understand it, and every person with a disability will is different and will take a little bit of information but won't get the whole story, and that's really sad. And I think you're right, Dolly, with the statistics, they are really bad because um, we, as people with learning difficulties, do die younger in the normal population, and that's sad because things are missed and stuff. But it's working with people with learning difficulties to recognise things and try to raise those things with their GPs or to catch those things quicker, really.
Just to add to what David and Joel said, I think it's important to mention that yes, isolation is a real concern. And we know that people who live in supported housing and in structure living conditions have more access to help and support because those structures support them and share information. It is not ideal yet, but they are more exposed to information about services that they have somebody kind of supervising in a way, or having interactions with them all the time, so they can identify something is wrong and maybe signpost them and help them. I'm really worried about people who live independently or people who live with families. If you are from ethnic backgrounds, you're more likely to live with a big family structure, which is amazing, and we should have more of that. But that means that sometimes mommy and daddy are looking after an adult child with learning disabilities and maybe physical disabilities, as well as elderly parents, as well as children. And so the capacity to actually know what's going on and understand that there is help available, to kind of explore potentially help for them as carers is not always optimal, because we're not getting to them. And if they don't access GPs and they don't access hospitals, nobody gets to know about them. And structures don't know that they exist, and it's more difficult, and they become more isolated. So I think hopefully this podcast will reach those communities and will open doors and will make more people aware of what's available, and what, even to feel more confident to ask for help. If you know that you can ask for help, that you can ask for a longer appointment, that you can ask for translations, that you can ask for, I don't know, more time to understand what's going on and what's the diagnosis, and all of those little things that make a difference.
Absolutely. And lots of the topics that you just mentioned are going to be episodes of this podcast because of this very same reason. Because, as you just said, lots of people don't know that they can have reasonable adjustments.
I was just going to say, I agree with Dolly that as somebody who looked after my nan when she got older, it's kind of really difficult because you don't recognise a person who's a carer, and carers get older, and the person with learning difficulty gets older. It's still a bit of a struggle, and it's kind of a bigger thing of what happens when they pass away, and what happens to that poor individual, who in the family is going to look after them. And it's kind of one of those things, it's a really big cycle. And I think, as Dolly said, let's hope people listen to this and get a lot out of it as well.
When reasonable adjustments are made, when communication works, when engagement works, everything works and people get positive outcomes, and that's a win for everybody. And we can all help. So having amazing people like Jules and David and everyone that works for the Elfrida Society is fantastic, because you share your experience, you share your knowledge, you inform the changes that are needed, and your families and your carers change their own perspective, their own experiences, their own barriers, their own challenges, and that informs changes. But then we need professionals as well, and we need the service providers and everybody that supports the community to also uh, kind of do their bit by listening and reflecting and looking at what can be done. Even with the constraints of capacity, with the pressures, things can be done. And if you listen and you reflect and you care to see things improve, and I'm sure we all do, then that will make a big difference, and we will be all winners. And that will be something that I would love to see happening, more of that collaboration, more of that support ending in real change and things improving, and everybody being happy, healthy, and having fun. So yeah, I think that's what I wanted to share.
Thank you, Dolly. David, is there anything that you would like to add, or is it all good?
I was just going to say, yeah, I agree with Dolly. We want a better society. We want people with disabilities to speak up in the NHS and make sure that they have any concerns to raise them with the GP, doctors in the NHS, LD nurses, anybody, to make that dream better, really.
I think if you invest in all of the things that we mentioned, you will see the results in less hospital admissions, uh, more time to spend with other patients, people having more healthy and happier lives, people taking up more a kind of initiatives that are preventative, like, we mentioned annual checks, cancer screening, do more for their health. So there is a real win when you make small changes and people engage fully in healthcare. So they will translate into all of those things that make a difference, and that will be important and fits really nicely with the NHS and the integrated care systems that are looking at improving equality, improving inclusion, and improving outcomes for the whole community. So there is a clear win when we do things differently.
And now, dear listeners, we already have a little surprise for you. Catherine Sorrell, Grants Manager at Cloudsley and funder of the Elfrida Society's Health and Wellbeing Project, of which this podcast is a part of, has recorded a short segment to introduce herself and share her thoughts on this new project.
Hi, I'm Catherine. I'm the grants manager at Cloudsley, which is a local funder in Islington. Cloudsley has been around for around 500 years. It dates back to 1517, when a man called Richard Cloudsley left 2 stony fields to the people of Islington. Those fields are located around Barnsbury, not too far from Upper Street, and now have lots of houses on them built by the charity. And the money from the houses and from sales of the houses and investments is given out in grants to organisations, individuals and churches in Islington. So about 50% of our money goes for health organisations and individuals, and about 50% goes on churches. So partly what we do is grants for individuals. We have a number of organisations called Cloudsley Partners, who are local organisations working in Islington, like Help on Your Doorstep, Age UK Islington, and Disability Action in Islington, who give out money of up to £500 to Islington residents. And that could be for things like white goods, it could be translation, it could be utility bills. If there's financial need and if there's a health need, then those organisations can give grants out. So that's part of what we do. And then the other part of what we do is giving grants directly to organisations to help people. And that's where Elfrida is funded. So Elfrida is funded under our large grants programme, which is giving multi-year funding, so 3 or 2 year grants to local organisations that are helping to address health inequalities. So the focus of most of our health funding is health inequalities. That is where there is basically reasons why one person gets to have good health and gets good treatment and another person doesn't get such good health or good treatment for unfair reasons. So that could be things like where you live and what your housing conditions are, but it also could be that you have barriers in accessing medical treatment and healthcare, that you're treated unfairly by the system isn't set up for you. So there are a number of reasons why someone could experience health inequalities. And I think for Elfrida, obviously the project that we are funding is directly healthcare advocacy. They're supporting people with learning disabilities to get proper access to healthcare, to make sure that they are properly listened to, that they get the appointments that they need, and that they understand and can make their own decisions around treatment. So it's really a very good fit for our aim of addressing health inequalities in Islington.
I'm so happy to cover this role specifically. It's so fulfilling for me as a person, helping people with learning disabilities accessing healthcare, because I can see not just with them, but also firsthand how inequalities work in terms of accessing healthcare. As a neurodivergent individual myself, I often face kind of barriers, and so I think that experience and the fact that I don't have as a comorbidity a learning disability, that kind of experience helped me building my professional life, and also learning the shortcuts and who to really talk to in order to support my clients. So yeah, that's very that's a job that I love. So thank you for wanting us. And this podcast is part of that project, because what we're going to discuss is basically what barriers people with learning disabilities face in their everyday life, mostly in accessing healthcare,
and we'll be talking about how to overcome those obstacles. And we really wanted to share that knowledge with everyone.
Thank you, dear listeners, for joining us for this very first episode of Don't Hold Me Back podcast. If you'd like to know more about the Elfrida Society, you can visit our website at www.elfrida.com, and you can find us on all social media platforms. If you have any questions, you can send us a DM, call our free phone number, or leave a comment below. And I'd like to thank David, Dolly, and Catherine once again for being with me today.
Thank you.
Thank you, Jules. Thank you, David.
Jules.
Amazing to be here. I can't wait to hear the episode.
Yeah.
Thank you.
Can't wait.
Thank you very much. And we'll see you again in a month for a brand new episode right here at Don't Hold Me Back, a podcast with and for people with learning disabilities. Bye.